Hi, this is Dr. Randy Goldstein, and the topic today is back to sport after COVID. If you've had the unfortunate occurrence of having COVID, or perhaps you've just been limited in practice because of all the new changes, getting back to full practice is like that first day of summer jumping back into the pool. We want you excited about your sport, but we also want you safe. If you're diagnosed with coronavirus, we'll call that a red case or positive for COVID. The typical treatment is 10 to 14 days if there's no complications. During that time, you're quarantined and being treated by a healthcare provider. No one's expecting you to be at sport, and so this is the time when you're the most protected. When you're allowed to return to training, we'll call that the deconditioned phase. It could take 2 to 3 weeks to get back to your pre-illness condition, and everyone expects that as well. What's interesting is once you're back to full sport, or you're expected to be at 100%, that 2 to 3 months after the diagnosis, when things may occur that were unexpected, after you've been ill and you're allowed to return to practice. We'll call that the deconditioned phase. It's the time that you're excited to be back, but you can't be expected to be at your pre-illness condition for a certain amount of time. And everyone's going to be a little bit different. Some people would suggest that if you've missed 10 days of sport because of illness, you should double that time in your expected time to get back. So 20 days, and then be back to 100%. It would be unreasonable to think it should only take one practice and you should be back to your pre-illness condition. And it seems a little long to take 2 or 3 months. So taking the amount of days that you were out and doubling it is reasonable. During that time, there are some risks to be aware of, though. Musculoskeletal injuries are more common after someone's missed a period of time of sport and then trying to get back to their pre-injury or pre-illness level. They may push themselves too hard and their muscle memory may not remember how to do a skill that once seemed second nature. Ankle injuries, ACL injuries, muscle strains to the quad and hamstring, and groin are all very common. And so doing a progressional return to sport is better than jumping in at 100% and then having to miss the rest of the season because of an injury. Nutritional issues after an illness or injury or a long period out of sport are something to be aware of. You may have a calorie imbalance. You may have eaten more without exercising during your illness time. Or you may have not been eating enough because you haven't been feeling good, and then expected to have enough calories to do your sport, maybe more than what's reasonable. And so making sure you have a calorie balance for your sport is important. There's some information also with coronavirus on zinc and vitamin D. And so talking to your healthcare provider to see if you need extra nutrients during your return to sport time is something to consider. While everyone's giddy and excited to get back to sport, some will have anxiety, depression, or be overwhelmed because the rest of the team had been training for the last 2 weeks, or that you weren't getting back as quickly as you were hoping. And so it's important to have the coach, the parent, the teammates watching out for athletes that are getting back to sport to make sure that they're mentally healthy. And finally, if you have underlying conditions such as asthma or diabetes, this has to be watched more closely on your first couple of weeks back to sport to be sure that everything is being handled well. It's the next part that I want to talk about a little bit more, and that's after you've had coronavirus, are there special risks to athletes' hearts, lungs, and kidneys? We really just don't know yet. Coronavirus has not been around long enough for us to research the long-term consequences of what it does to the human body. And that's just the human body under normal circumstances. Although athletes are faster, stronger, and in better shape than non-athletes, they're also putting their bodies at tremendous stress, and they may be at more risk than the non-athlete after coronavirus. While these things are unusual, we're not expecting them to happen at a great rate. We at least want the coaches and parents and athletes to be aware that these things could happen, so that if returning to sport isn't going as well as you expected, or there's complications occurring, that you not overlook them or not get someone to a healthcare provider that needs extra help. The heart under stress and having had coronavirus could have an increased risk of rhythm abnormalities, myocarditis or inflammation of the cardiac lining, and even sudden cardiac death. The lungs could have inflammation in the lungs, blood clots in the lungs, or decreased pulmonary function for a long period of time. And the kidneys could have decreased renal blood flow, decreased renal perfusion or function, and even acute renal failure. Again, we're not expecting these things to happen to people or to athletes, but if there's complications occurring, such as shortness of breath, chest pain, dizziness, fainting, difficulty going to the bathroom, or not going to the bathroom as much as they used to, these are things that should be looked at by a healthcare provider and not just overlooked or assumed not to be dangerous. There's lots of tests that can be done, and some of the professional athlete organizations are considering doing some of these tests on athletes after coming back with coronavirus. But the testing is extensive, expensive, and can be stressful. So does every athlete need this list of tests for their heart, lungs, and kidneys? I think it's unreasonable at the club level or high school level, perhaps even the college level, to be running all of these tests on every athlete that had coronavirus. But I do think that we should be aware that there is tests available if athletes are having complications or they're not getting back to sport as quickly. I think what is reasonable at the club level is to at least be aware that these things are possible. If the athlete is progressing as you would expect, then there doesn't need to be any restrictions or special testing. But if the athlete has shortness of breath or chest pain, dizziness or fainting, then not just blaming those things on being deconditioned, but knowing that there's possible dangerous things that could occur after coronavirus, that a healthcare provider may want to run some appropriate tests to make sure the athlete's safe. Following the CDC guidelines when an athlete has coronavirus makes sense, but so does progressing slowly back to practice, not only to reduce the risk of injury, but also to put the appropriate amount of pressure on the athlete in getting back, and not too much pressure in getting back too quickly. Every athlete will progress at a different rate, and just knowing that there are some things that could come up after the illness is already resolved that could still be dangerous. Warning signs for heart, lung, and kidney injury aren't likely, but we also don't want to miss them. Well, this is Dr. Randy Goldstein, and I hope that you found this helpful. Be well.